So I know there are a number of folks here that are working with other organizations as well, and we have a microphone because I believe the session is being recorded just so we have some record of what actually is happening. So we'd like to open the floor to discussion to address either questions individually or just to the group. And who is brave enough to stand up first? Joanne.
I just have a question or a request or comment. I know that a number of the children have already come here. There's 5 at our hospital now, and I'm told 5 more on their way. So, but in preparation for them to go home, keeping in mind HIPAA regulations, we need to be able to give these families the information that they need to be able to follow up their care. So is there anything in place that we need to do to be able to manage that?
Yes. The United Nations World Health Organization is setting up a centralized call desk where it's basically a toll-free number that they will be broadcasting on the Haitian radio. And families will be able to contact that number and be told what, they will tell that operator what part of the country they live in, and they will be referred to an organization that is helping in that area. Also through the UN medical cluster, through this World Health Organization medical cluster, there's a whole list. I mean, there must be 300 organizations that are on that list. And so we can disseminate that information through some of the websites that have already been set up to respond to the medical needs.
So we just want to have discharge planning so that when we can help direct these kids for their follow-up care once they just get discharged from our hospital.
And I'll add to that I was contacted by therapists from Children's Rehab in Atlanta, and they have had a presence in Haiti, and they are, as we speak, translating various physical therapy manuals and things into Creole. And as soon as this meeting was over, we're going to contact them and put them in contact with our website, Oakland Academy, so you can have probably something in America to give them, and then they can continue to follow up through the international efforts when they get back in country. So we'll make sure that that contact information is on the website, and that you can directly contact us, because it'd be nice to have things in their native language.
That would be very helpful, and I can also just kind of attest to the cultural sensitivity and the cultural need, because we're certainly, even with some training that we had before they arrived, certainly trying to work through some issues to maximize outcomes as well.
Thanks for helping.
My question and comment is actually related to that. I was wondering if you've ran into language barriers since you've arrived there, and also I'd like to propose some type of online learning module or something that as people are preparing to go, perhaps you could sign up for it, learn some basic communication and medical terminology. I'd even be willing to pay for it, so to have it be twofold in the sense that it'd be a fundraiser, or the proceeds could go directly to that, and also know their native languages.
The University of Indiana has a great website that is specifically geared towards Haiti and Creole language. There's also another website that has been kind of reactivated that has some common Haitian phrases on it. So if you just Google Haiti Creole, Kreyol, you will find some resources on the internet.
And Al, we could work on making that something to put the OLC.
But also, there's a lot of unemployed Haitians right now, and many of them speak very good English, and they're more than willing to be hired for about $20 per day. So you can certainly hire your own interpreters.
A question maybe for Rob and maybe for the folks here from Rob. If you could speak to how POCC is involved in we are getting lots of patients who are bringing their devices to us.
Sure.
And we've historically put them in a bag and given them to Rom.
Yeah.
But can you speak to what the POCC involvement is and what you've identified, how you're going to take what arrives at your doorstep, strip, what do you need, and then ship out?
Sure, thanks.
Thanks.
And I think I may have glossed over this in the presentation. POCC, or also referred to as POCSI, is the Prosthetic and Orthotic Component Clearinghouse. It's a component recycling project that was started by MedShare International, US ISPO, the Bar Foundation, and Georgia Tech, the MSPO program at Georgia Tech, in response to the same situation where every prosthetist and every office has all these components that can be used. They're still useful. They're just not usable in the United States. To try and find a way to distribute the components in a smart way so that you're not setting up clinics that are putting out of business an adjacent local company, but you're actually finding ways to work with them and to prevent everything from just being thrown into the landfill. For those of you that aren't familiar with it, the website, it's the US ISPO website, so usispo.org/POCSI or POCC. The premise for the mechanism that POCSI works through is that individuals can donate if they want to donate through an organization. So, for example, the Bar Foundation is partnered with POCSI. So if you want to make your donation through the Bar Foundation, you can make your donation through the Bar Foundation to POCSI at the warehouse, and all of the equipment, all the components, equipment, materials become part of MedShare's stock, because by law anything in their warehouse has to belong to them. So it in turn does get donated to POCSI. The items are then disassembled, inventoried. The inventory is put online. Items that don't require prosthetic and orthotic specialty, so anything that's off the shelf, we generally will then package up, inventory, and give it to MedShare because they do supply orthopedic hospitals. So your small, medium, and large, or your things that are based on size, those are things that go into the general MedShare collection. The things that require prosthetic and orthotic expertise then are inventoried, and we have an application process whereby individuals, either people who want to go on a trip somewhere or organizations that have clinics anywhere else in the world, they can submit an application to be able to get access to these components. There's a committee that reviews the application. There are things that people have to do in order to get the components. They certainly have to arrange for the shipping. There's a small warehouse fee. And then individuals can just request those components. The warehouse fee is $75 for 50 pounds. Any of you that have tried to carry 50 pounds of components into another country will know that that's actually a lot of components. And then it becomes accessible to those people who want to use it. They are not allowed to resell the components, so we're trying to absolutely prevent black market from happening where you get a bunch of components and then they drive around to whatever other facilities and start providing those components. And we're also trying to make sure that the components that are provided are appropriate to the environments that they're being provided, because a lot of the stuff that we use here just isn't good for these different types of areas. And that's one of the large concerns with Haiti, is how you're going to, I'm sorry, if you're going to give the guys a sea leg, it's a great leg until the battery charger goes out, but they don't have any power, so there's things that are appropriate. That's an extreme example, but we have gotten donations of sea legs, and what are you supposed to do with these sea legs? We haven't quite figured that out yet. So that's kind of how POCSI has actually been established. It was started in 2007. The website has been updated as of the last week and a half, and it will allow for groups that have, if you have components that you wish to try and merge with this, you don't have to get them shipped to Atlanta. If you have a warehouse of stuff, you can actually get that inventoried in your area. That would become effectively another closet of components, because maybe somebody needs that specific components that's there. So the model was set up so that it can be web-based, and there can be different component closets or different warehouses anywhere in the country so that people can go and find out what's available and use it, as long as they meet, again, the certain requirements for using those components. Thanks. Where'd you go? Yeah, thanks. Tyler.
Hey, Rob. I recently saw a documentary that followed 10 volunteers as they helped with Hurricane Katrina, and all 10 were very successful in what they were trying to do. All 10 had a positive experience, and all 10, a year after the fact, had some sort of clinical repercussion. And it made me realize how much I would need to prepare myself, not just physically or mentally, to go into something like this. And I was hoping maybe you could speak on what that would be like to someone who's doing anything like this for the first time.
Maybe I should bring you up here to tackle that one. That is a really, that's hard to answer, and I'm not trying to downplay it all. I think Haiti is one of the harshest environments I have ever been to. I haven't been all over the world, but I've traveled some, and I heard Jeff Martin say today that 2 days in Haiti felt like, what, 2 weeks, or was it 2 months?
2 years.
2 years, okay. The environment is so harsh, and especially right now with the number of organizations, bottlenecking everything, that it's hard to get around the smog, the cooking fires, just everything is creating a lot of extra heat and stress on people. Obviously, working in this environment, you're going to see some very traumatic situations. You're going to hear some horrific stories, and you're certainly going to see some very tough things. I don't know if I've completely processed what I saw the first few weeks after the earthquake. Maybe having been there so many times before, I was a little prepared, and watching the news 24/7 after it happened might have prepared me for the buildings and everything. But it was seeing the people and smelling death that really has stuck with me. For the first month, the smell of dead bodies was almost everywhere, because these buildings just weren't being accessed to get the bodies out. But that, for the most part, has subsided. But obviously, there's still just horrific ruins there, and so it is very tough to see and hear that. But it's the great thing about our profession is that we're able to help people. We get them up and going again. So if you can see those smiles when we get that child back up again, or get someone back into the community, that's going to really help you heal after what you've seen, and obviously it's going to help them a tremendous amount. So I would not be discouraged at all by what you're going to see.
Al, can I tackle that a second, please?
Sure.
There's a line too, but
No, I just wanted to bolster that point. I've been on 5 romp trips to Guatemala, and it's the first thing you're thinking is, well, right, you're going to see some tragedy, but I just want to kind of echo the last point that you made, that it's the most empowering thing that we do, is to get people up, back into their lives, and to have that, young kid or mother walking in. It's just the most rewarding feeling. And what's going to happen is it's going to be contagious. You're going to want to do it more and more. So I would say, I think you bring up a wonderful point. And I think if you do wind up going down there, what you're going to find is that you've had maybe the most rewarding experience of your life, and you're going to want to do it some more.
Great. If I could just address the question about how do you prepare. Let me just I know we're getting late. I just want to mention a couple of things, and Jim asked me to mention some of our activities before we take a couple more questions. Imagine, if you can, when you say prepare, January 12th. It was a day like the normal day in Haiti. People were going about their business. Some folks were at work. Some people were at home getting ready for dinner. It was about 5 in the evening. Patients were in hospitals. Healthcare providers were taking care of them. And at 5 p.m., the earth started to shake. And for 40 seconds, it shook more and more violently. At the end of that 40 seconds, more than 300,000 people were dead. We heard earlier, 38% of the buildings in Port-au-Prince had collapsed. Hundreds of thousands of people were injured, and 1.5 million people were homeless. That's a huge event, folks. Those are numbers you can't even get your hands around. As a group, we can't possibly get down and shelter 1.5 million people. We can't get down and rebuild those 38% of the buildings that collapsed. One thing we can do is we can help those 4,000 amputees, and we can do it better than anybody in the world. And what we're talking about tonight is that opportunity. I congratulate Al and Jim for their work for many years down in Haiti, but certainly the needs down there exceed just those few organizations. We've been referred to as our efforts at Hanger, and I want to share with you, we're actually the Haitian Amputee Coalition. We're made up of a couple of organizations. One is a Physicians for Peace. Mary, I see you here, if you'll raise your hand. They've been great partners and done a lot of work in Haiti for many years. The Harold and Corita Anderson Family Foundation, who put a lot of resources to make this possible. Dr. Don Leslie and the Shepherd Center in Atlanta, and of course the Hanger Ivan R. Sable Foundation. We're newcomers to this. We sent a team down that took a look at what was happening in Haiti, and they went fairly quickly after that on January 28th, made an assessment, and you heard earlier Some of our clinicians then came back, put together some information pamphlets led by Kevin Carroll, and by February 2nd, 5,000 of those information pamphlets were down to the amputees. On February 12th, our first plane load of equipment landed in Haiti. That was a DC-3 built in 1947. That's what we could find, but we had it full of 3,800 pounds of equipment. On February 7th, our first staff arrived to start setting that lab up, and on the 21st, our clinicians arrived. And we've seen, I think, 7 patients as of today, within a couple of days, and have them up and walking. But I got to tell you, we can't do this alone, nor can the other organizations. We need your help. You can either help through your generous donation of your money, or more importantly, your skills and time. And I encourage all of you to work either with our organization, the Haitian Amputee Coalition, with Al or with Jim, and come down on the ground and help. What we can do is help you once you get there to get you to a safe and secure location, as safe and secure as you can have in Haiti at this point. But we can give you the opportunity to help a lot of people in need. We encourage that.
Thanks, Jim.
Hello, John Batsdorf. First of all, I wanted to thank you not just for the direct work, but also for making this the coordination of the different activities, because I think this is probably the most coordinated in terms of different organizations, instead of working close to their chest and every NGO working separately, which I've seen in other responses. I think it's fair to say anybody that's done this work has seen that this is the most cooperative effort, probably prosthetics from our industry, but also I think for others, most cooperation of any response to a disaster. And I think that's, there was a mention about how proud we can be about the response that we are to this, but also I think I'm very proud about how people are working together on this to say, let's do all that. So anyway, thank you for that. I have a question. I think this educational program that's getting put together out there, UDB, which sounds really like a great idea, and I don't know, of course, any of the details, but as it's being put together, I know that these programs, educational programs in prosthetics, are limited in the number of people they can serve because of the difficulty of putting together a workstation. But and I've looked at the programs, some of the area requires working at a bench, and some of it are lectures on anatomy and things like that. And I wonder, well, another aspect is, as you mentioned, there's going to be a whole range of different projects, and there's going to be a range of how much of a component is going to be educational, from some of them that are just going to be fitting to some like this education program that will be very educational. And hopefully many of them will have some educational component. But that's, as I just say, it's very difficult to provide. So I'm wondering whether, as you're putting together this and working with Heinz, to make the educational parts that are not the lectures and things like that, whether they could be set up so that they're more available to many of the different programs. They could be in a room like this, the anatomy, so that if somebody's running a program here, they could send their people to the lectures on anatomy, and then they could go and do their work at the workstation, maybe even with materials that are provided through that. So using a model to maximize the lectures that are there and not have those also limited by the workspace areas. And maybe that's already been thought of, but I just think that would be an idea.
The current structure is set up using the distance learning curriculum. So the students were going to use internet CD-based modules, and then every 6 months or so they would be tested out on the theory. But during that 6 months, they would have visiting professionals, i.e. us, coming down to assist them with the module that they're currently working on. So if it's transtibial prosthetics, we would be coordinating prosthetists coming down to teach that technique. The other component of it was that we were working within both countries. So we were going to rotate countries depending on whose turn it was to host seminars. And we were just going to go back and forth every other seminar, basically. But this was very small. I mean, we had 6 scholarships before all this happened. Now we probably need 60. But ISPO generally requires people entering the Category 2 training to have at least 5 years of experience. So there's probably less than 10 on the entire island that have that qualification. But it's a great point, and obviously we're going to need to expand the whole.
Yeah, I thought since the need is so different here, that maybe the model has to be sort of
Right.
a little out of the box.
Well, I mean, there's certainly going to be the need for hiring many what we call Category 3. I mean, the technicians who are putting the limbs together, but there's going to be many fewer Category 2.
Thank you.